Hi everyone, it's Chris. Welcome to my video. Today is the 15th of May 2013 and this is just basically an update video. I am 2 weeks and 2 days post-op. I had my surgery on the 29th of April and I cannot believe the results. I mean, really, it's fantastic. It's great to have such a flat chest. Yesterday, which was the 14th of May, I went to Hull, which is in the UK, to see the surgeon just for like a general checkup, so that he could see how I'm healing. And he is so happy with the results. So am I, to be fact. He's really happy with them. I am more or less completely flat. He said that he did leave a little bit of tissue in, so that it looks like I've got a bit of pecs, but once I build them up, you know what I mean, no one's really going to care. I'm not going to care about that little bit of tissue. At the end of the day, to say that I used to be a double D sort of cup and now I'm just completely flat, that doesn't bother me whatsoever. The scars are healing really well. I'm going to take my top off in a minute and show you, but the scars are healing really well. The nipples are coming out really well. You know, they've scabbed off and they're looking nice and pink, as Mr Kneeshaw said. So yeah, they're just going really well. Don't know what else to say, really. I'm dead chuffed with them. I'm so happy with the results. Now that it's been 2 weeks, I can do a lot more things. I can start sleeping on my side. Well, I've started sleeping on my side in bed. For the first, I don't know, about week, I had to sleep more or less on my back. I struggled to sleep on my side. But now I'm sleeping on my side nearly every night. You know, it might be minimal to some people, but it is quite, especially when it hurts, you know, it's quite big for somebody who's had top surgery. You know, I'm doing a lot more. At first, it felt like I still had my binder on, but now it's, I just feel free. You know what I mean? It doesn't feel like I've got a binder on anymore. It feels tight, as it's supposed to do, but it doesn't feel like that. I gave my binders away to my good friend Nick. So I hope you get a lot of use out of them. I hope they do help you. I'd rather give them away than, you know, keeping myself. There's no point in keeping them. You know, they were good standard. So, you know, and good wear. Well, not good wear, but they were just, some of them were hardly worn. So, today also, first day back at the gym. If anyone asks, don't ask me why I'm holding brown tape. Don't ask me why I'm knocking it everywhere. Yeah, that's a really random thing. Yeah, today, first day back at the gym. So happy to be back there. I'm just on a monthly contract, $19.95 a month, and I'm just going to see where it goes from there. I'm so happy to be back though. Some things that I've noticed I can't do. I can go on the bike, for example. The bike is all the, you know, lower legs, you know, using them muscles. Treadmill I can do on an incline, just walking. Did some sit-ups, because now I wanted to concentrate on my stomach. But I went on the cross trainer. I found it a bit difficult on there. It's like what one of the trainers said at the gym. At the end of the day, on the cross trainer, you kind of got a bit of a bounce. Anybody's got a bit of a bounce on there, so it makes your chest kind of bounce, so that might hurt a little. I did about 5 minutes on there, so 5 minutes was long enough really, but I'll increase it as the weeks goes on. I'll increase that, but I'm just happy to be back. It's like what my friend Danny said as well. He had the same surgeon as I did. I hope you don't mind me mentioning it, Danny. He kind of pre-warned me about this. When he had his chest done, he found that his stomach stuck out. Even though he's small, he's quite a bit smaller than I am. He found his stomach stuck out a little bit more than obviously before, and I found that I've kind of become a lot more conscious about my stomach, which is why I'm really going to try and work on it now. You know, sit-ups, shit like that really. I wanted to show you my chest. The surgeon yesterday, Mr Kneeshaw, he gave me some microporous tape, which he said I've got to wear for the next 3 months. Change it a couple of times a week or when it starts fraying. So when it starts coming off, change it then, but change it a couple of times a week for the next 3 months. Then after that, use bio oil, which I've got some in the bathroom, so that's kind of no problem. So I'll just take my top off and show you. I'll just pull this down. I still feel like I think I've put like half a stone anyway, which I'm not really happy about, but now I'm back at the gym, I should lose that. So that's the chest. Can't really see it good from there. I'll just turn this camera around here. That's better, you can see that better there. Right. So you can see this tape here, keep that on for the next 3 months. Obviously, like I've just said, change it a couple of times a week. So, turn that way, it's better. Very flat, as you can see, really flat. Nipples, scabbing, but all in all, they are really good. They've come out really well. And pink. So yeah, all in all, it's pretty damn good, if I say so myself. You can't see it better from that side, but I'm really happy with that. I cannot believe I've still got a flat chest. Yeah, I'm so happy with that. Like, I don't know what else to say. It's something that I really wanted doing for quite some time. Just a big step in the journey, really. My hair does look a mess. It needs straightening, to be honest. Just can't be arsed recently. So yeah, there we go, update. I hope everyone's alright, and take care, and I'll speak to you all soon. Later.